Upon entering the community of Fisantekraal, there were so many community members to meet and interview in order to get to know and understand them a bit more. We met all the women involved in the soup kitchens and spent some time with them within their homes. Some of the women we managed to interview within their homes. However, many times there was quite a lot of distractions surrounding us during the course of the meeting. For example, dogs entering and leaving the room all the time, children playing in the same room, etc. At times, this got a bit overwhelming through trying to focus on the interview, which made it quite difficult with so many distractions around us. That is when we remembered the UWC office, which Joey had informed the students about at the beginning of our 7-week stay. We began using this office space to complete all of our interviews and meetings for our designated projects, as it was well equipped with enough tables and chairs, which means we could successfully apply COVID protocols through practicing social distancing. There was also a sanitizing station, which made it more convenient as all the community members were able to sanitize upon entry, which made myself and them feel more at ease, since we were always sure that we were always reminded about our precautionary measures.
In terms of using the facilities that UWC has made available, it really caused a significant change in the way we were able to conduct sessions with the community members, as it provided a comfortable, clean space to work in, which will definitely benefit future students. From one student to another, we would just like to send our sincere thanks to the community of Fisantekraal and allowing us to work with them. We've never felt so welcome before, and we didn't know that this place would become another home to us, but it did. So we would just like to thank the community itself for everything that they have done and the opportunity they have provided us with.
I'm from the community. I'm from the very first people that moved into a new house here in Greenville, and I'm very lucky, and I'm still happy in my new house. My position here is to look and to see that the river is clean and illegal dumping don't take place, because like you can see here, this area especially was a lot of dumping was taking place here, and we was making 100% sure that people stopped dumping, and we started to plant these vygies. So we must make 100% sure that no litter go to the river, because our little animals can die about that. The UWC students is a big help for us in our community, because the students also go to the community to go and talk to the homeowners and tell them how illegal it is to do illegal dumping, and that they can get a fine. The UWC students also helped us to clean our community, you understand? So to me, wow, I don't know how to say it, but we are very happy when we hear the students is gonna come. So I'm very proud of them, and I hope not to lose them, because they must come again. They help us. They even help us with the community garden. They painted bottles for us. They put papers in. They make our garden beautiful.
My name is Dr. Bini. I'm a third-year student from the University of the Western Cape, and my group and I have been assigned to work on the environmental health project. At the moment we came here, we saw how pollution is a problem and how people are dumping, and it's high time that the world and the community of Fisantekraal know that and know how our pollution is a danger and pollutes our environment. And it's high time that people know that dumping is a crime. So I think that it will be a very good thing for the community and for our growth to inform them of how pollution poses dangers to their health, and to how their children can grow and have a nice place to play and everything. So this place might look clean this side, but even one piece of paper is a problem, and it could really contribute to the problems that we're facing globally, like global warming and the ozone layer depleting and everything. So I just think that the community would really learn a lot and try and, see better ways to live and make the environment a better place. The pollution around might also contribute to health issues that the community is facing. For example, children can play around the dumping site and everything, and they can pick up a lot of infections and diseases from the area. By doing this, we will be gaining marks for the effort that we put in and for the way that we interact with the community, because we are here as health workers, but also we have to see the things that interact with health and the things that would pose a danger to health or to the healthcare system.
My name is Prudence and I am the social worker at USAPO. People come here for different reasons because there aren't a lot of facilities in Fisantekraal. So people come here if they need direction on where to go, if they need to apply for ID, if they need assistance with SASA. So the UWC has partnership with USAPO Foundation. So what we do is we receive fourth-year occupational therapy students from UWC, and they come here for a period of, I think, 3 to 7 weeks. And then what they do is they help us with the project that we have, such as the Amandla support group. The students normally help us with the recruitment, and they help us spreading the word in the community about USAPO Foundation, and they also introduce themselves and get to know the community. So far I've had 2 groups of students at the beginning of the year, and then the others came in, I think, in June. And I think it's been a great pleasure working with them. They are joyful, full of life, and they really want to make a change in the community. They want to help USAPO, and they also want to grow as they are going to go into the fields next year. So I think it's been a great experience, and it's a pleasure having the students here to assist us.
Good morning, my name is Trudy. I'm the principal of Teletubbies in Fisantekraal, and we were started in 2008. We started with 6 children, and so we get registered. We were registered for 12 children. We were in the Wendy house at the back of the house. So we renovate the whole place, and so we now registered for 28 children. And we had a fine motor problem where the children can't hold the pencil correctly, and they couldn't, the scissors, they couldn't hold it correctly. So they worked out some things, they helped us with that. So things that we can keep and can always get back to, if we struggle with a child there, and then we go back to this book and see what can we do and how we can help the child develop the skill that they can't do. Like some of the kids, I remember one child that couldn't catch a ball, and when then we having an outdoor play, so they do some stations, and they were teaching the child how to catch the ball and how to throw, and that type of things, yeah.
It is not only exciting but also important for the Faculty of Community and Health Sciences at UWC to launch and open its site office in Fisantekraal. I wish to take this opportunity to acknowledge and thank Prof. Rina Swart, the former Deputy Dean in the faculty, who initiated the discussion and engagement with the leaders and community members of Fisantekraal. This was the beginning of a strong community-university partnership that has now culminated in the establishment of a UW site office in Fisantekraal. Since 2017, UWC has been involved in the Fisantekraal community and involved in a number of community development projects such as health and wellness projects, involvement in the early childhood development program, the youth programs, home-based care programs, as well as involved in relevant and exciting research projects. This site office will provide not only for the UWC staff and students with a vibrant space for building capacity and for growth, but also it will include the members of the Fisantekraal community. I wish to commend the faculty leadership, the departments, the units, the schools, and the centres, as well as the support staff who continues to support the initiatives in Fisantekraal. Indeed, the community and their voices is at the heart of what we do at UWC and in the Faculty of Community and Health Sciences. And we strongly believe that as a socially responsive university, we can make a difference in the lives of this vibrant community. I look forward to working with all the stakeholders involved in Fisantekraal. I thank you.
Good day everyone. As the Dean of the Faculty, I am excited about the launch of our site in Fisantekraal. An important component of what we do at the Faculty of Community and Health Sciences is to enhance the health and well-being of communities. We do this through our community engagement activities. The work our students and staff do in collaboration with the Fisantekraal community is very important as we aim to make a difference in the lives of others. Some of the exciting work that the students will do while being trained as health and social science professionals here in Fisantekraal will include health promotion, where at-risk groups such as those living with hypertension are given health education. In addition, children with learning disabilities could be screened for school readiness, and individuals with stroke could receive rehabilitation. Being part of Fisantekraal, we're making it possible for a part of our society who does not have access to healthcare to receive health services. Let's continue to broaden our ethos of leaving no one behind by assisting the people of Fisantekraal receive health and social care services they need. I thank you.